So next up, we have two trainee data blitzes. And first up, we have Brady Lorenz. And Brady is a PhD candidate at the University of British Columbia's Okanagan campus. Her research focuses on understanding brain dysfunction in women who've experienced intimate partner violence-caused brain injury. Specifically, she's looking at perturbations in balance control and circulating hormone levels, such as estradiol, progesterone, and cortisol, following IPV brain injury. So please give a warm virtual welcome to Brady.
Share my screen here. Okay. So first of all, I would just like to thank you guys for having me. So yeah, this is a part of my project dealing with quiet stance postural control in women who have brain injuries as a result of intimate partner violence. So kind of just a quick preface, even though we've probably been over this a few times in the last couple of days. IPV, anything physical violence, sexual violence, psychological aggression, stalking by a former or current intimate partner. Globally, about 30% of women over the age of 15 experience IPV. I am located in Canada, where 44% of women who have ever been in an intimate relationship do report experiencing some kind of physical, psychological, or sexual violence in their lifetime. IPV does cause this array of different health outcomes, but most commonly does result in blows to the head, face, and neck, putting individuals at high risk for brain injury, both via the actual impact itself and hypoxic and anoxic brain injuries with the strangulation as well. So with that being said, about 92% of these IPV survivors do potentially suffer a brain injury. So as I mentioned, both this IPV-caused traumatic and hypoxic brain injury can lead to neurocognitive impairments, similar to those seen in sport-related concussion, as well as things like anxiety, depression, and PTSD. Another thing that I'm going to be focusing on in this talk today is balance impairments. So these are fairly well documented in the sports concussion realm, where we're trying to just stand upright with those athletes. Our center of balance has to fall kind of within our base of support, and any kind of disturbance to that, faster movements, more pronounced movements, larger area of sway does lead to or indicate these disruptions in balance control. So again, this has been pretty well documented in the sport concussion literature. These changes in postural stability have been shown both immediately following sport-related concussion and are thought to persist for at least 3 to 5 days post-injury. However, some studies do show that these balance disturbances, again, in the sport population, do last up to 1 month or more following injury. So that kind of led us to this current study looking at kind of chronic remote brain injury in women who have these brain injuries, again, as a result of intimate partner violence, and seeing if we can compare that to this sport concussion group with these different balance disturbances. So the purposes of this study were to characterize these different aspects of postural stability, which I'll go over in, I think, the next slide, to determine the effects of IPV-caused brain injury on quiet stance postural control in these survivors. We also wanted to look at the correlation between these balance control variables and psychological factors seen in IPV, such as depression, anxiety, and PTSD as well. So the principal criteria for this study was at least one reported incidence of IPV. So we were able to recruit 40 participants from local community partner sites that were included in this study. They did 2 sessions, so the first of which they did the psychological assessment, so the CAPS, clinician administered PTSD scale, to look at PTSD symptoms, Beck's depression and anxiety inventories to look at, again, those symptoms of depression and anxiety, and also the BISA, or the Brain Injury Severity Assessment Tool, which is a structured interview used to characterize brain injury exposure resulting to any impact targeting the head, face, and neck, and also takes into account non-fatal strangulation as well. This BISA score gives us a score between 0 to 8, and then we can look at kind of the participant's exposure to brain injury throughout their lifetime. They then came back for a second session where they did the assessment of sensory motor function. So they stood on a force plate for 60 seconds with their eyes open and then with their eyes closed. They were just told to stand quietly with your hands on your hips, your feet shoulder width apart, and try basically just not to move and just maintain balance. So after some coding and stats and a lot of MATLAB, we came up with these different markers for balance control. So center of pressure area, so that total center of pressure area that the participants were moving over. And then we also looked at some different individual variables as well. So in both the mediolateral and anterior posterior directions, we looked at total displacement, variability in sway, and then their sway velocity as well. So you can see here are just some of the traces representing those balance assessments. So you can see the green is representing kind of the best fit ellipse, that total center of pressure area shown there. The blue lines are the participant's actual movement. And then the red are indicating the displacement in the anterior, posterior, and then mediolateral directions as well. This participant did have kind of a moderate brain injury, but again, you can see the different profiles compared to their eyes open and eyes closed, and kind of that movement where, again, the participant is just being told to stand still, but they are, again, moving around quite a lot and have sway. So moving on to the results. So just to go over some demographics quickly. In the full sample, the average depression score was 24.08, with about 55% of participants reporting moderate to severe levels of depression. We also found 67% of our participants, again, reported moderate to severe levels of anxiety. And we had about 75% of our participants reporting very severe PTSD symptoms. So all three of our psychological properties that we were looking at were very prominent in this population. We didn't have any significant differences across the three BISA groups with those, so with depression, anxiety, or PTSD. And the average BISA score in the full sample was just under 4, so moving into that moderate range. And we actually had 95% of our participants did experience signs and symptoms consistent with a brain injury. So out of the whole 40, we only actually had 2 participants that scored 0 on that BISA. So again, indicating this really, really high incidence of brain injury in survivors. So moving on to some results. So we initially did a 2-way mixed ANOVA, which I didn't show the giant table here. But we did find significant within subjects effects on kind of these 3 measures. So center of pressure area, mediolateral amplitude, and mediolateral variability. And then we did Bonferroni corrected post hoc tests for these groups to look at the differences between the low, medium, and high BISA load. These tests revealed significant differences between the low and high BISA score groups for center of pressure area, with that area being increased in the severe brain injury group, as seen in figure this A there. And then also we saw these same scores with mediolateral amplitude, so the amplitude of their sway, and then the variability in their sway as well. Again, differences between the low and high BISA score groups, and then in terms of mediolateral amplitude, we also found significant differences between the moderate and severe group. Again, indicating that those increases in the sway measures, meaning worsening balance control. And then kind of the last graph I'm going to throw up here was the results of a multiple linear regression analysis, looking at kind of the differences in psychometrics and some demographics. So highlighted in blue there is shown to be what was significant. So both BISA load and the CAP score were actually found to significantly contribute to COP area, mediolateral amplitude, mediolateral variability, while keeping all other variables constant. So again, brain injury being kind of the main modulator, the main contributing variable with the difference balance factors, and then the CAP score as well. So last few minutes here, just discussing some of these results. So first, differences in balance control were observed during eyes open versus eyes closed condition. So this is kind of consistent with previous studies showing worsening balance control in the eyes closed condition. This is described as the more challenging condition as it largely taps into proprioceptive and vestibular functions, causing these balance impairments. So this means that those with a history of IPV-caused brain injury may be particularly vulnerable to these balance deficits under the eyes closed condition, where they're really trying to tap into those proprioception and vestibular functions that may be damaged from the brain injury. We also saw that exposure to IPV-caused brain injury modulates variables such as COP area, mediolateral amplitude, anterior-posterior velocity, and mediolateral variability, meaning that the higher the BISA score, greater the brain injury, the greater the disruption to balance control. Kind of our new, I guess, most novel finding, most confusing finding is that PTSD symptoms significantly contributed to variations in balance control in the eyes open condition, not in the eyes closed condition. So we actually did see an improvement in balance control with eyes open in the participants who had PTSD. So this could be related to previous work showing that eye closure resulted in increased body sway for PTSD patients, and kind of this thought of tonic immobility where they kind of go into this freeze state when they have PTSD. So they may not have as much sway, not because they have necessarily actual improvements in balance control, but because they're kind of frozen due to the PTSD. So the results of this study provide evidence that balance assessments could be useful in diagnosis of chronic remote brain injury, and further research should be done to explore these relationships between anxiety, depression, and balance control in survivors of IPV. So again, just to kind of wrap up here, postural control was shown to worsen with more exposure to IPV-caused brain injury. PTSD also was found to contribute to changes in balance variables, and there's this really complex relationship existing between IPV-caused brain injury and postural control in survivors. And that is it.
Thank you so much. We probably have time for about one question. So something we got in the chat was whether you looked at time since the brain injury, and if so, if it affected your results at all.
Yes, so we don't have that data. Our population was all kind of remote in time. I think the most recent one was 3 months previously, but I think the greatest one was like 16 years in the past. So it is this really kind of wide range of the different groups. We're hoping that we can do some sort of assessment with the acute participants in the near future, but yeah, haven't. That's kind of the next step, is looking at the acute group.
Yeah. Okay, great. Thank you so much. All right. So with that, if you have any other questions or comments for Brady, please post them in the chat or in the Q&A section, and we'll go ahead and move along to our next trainee.